to welcome our very acclaimed doctor, Dr. Vanita Raut, who is present here with us, and she will be answering some of our questions regarding today's topic, which is influenza vaccines during pregnancy. So before jumping to the questions directly, please tell our viewers something about yourself.
Hi Riya, hello. I'm Dr. Vanita Raut. I've been working at Dr. L.H. Hiranandani Hospital, Powai, for last almost 16 years. Before that, I was professor at St. G.S. Medical College and KM Hospital, and I worked there almost for 21 years. I'm interested mainly in high-risk pregnancies, vaginal surgery, adolescent gynecology, and gynec oncology.
Thank you, doctor. And doctor, what moment would you say was the moment when you decided to become a doctor?
Well, there's not a particular moment as such, but on the whole, probably I had an inclination to go for a science, or otherwise it would have been a commercial art. Then I thought, if I take up medicine, I can always pursue art, but if I take art, I cannot do the medicine. That probably made me go only for the medicine.
Alright, doctor. As the topic itself says, influenza vaccines during pregnancy. So doctor, what is vaccine in general and what does it contain?
Vaccine is probably the most impactful scientific innovation which has occurred till now. Vaccines protect people, not only people, like a generation of people at their various lifetime from the infectious diseases. Vaccines are given as soon as the baby is born, they are given in childhood, adolescent, even pre-pregnancy there are certain vaccines which are given during pregnancy, and it doesn't end over there. Again, the elderly people will require some vaccination like a pneumococcal vaccination to protect themselves from the infectious diseases. A vaccine contains the disease germ. But this disease germ is either killed or it is weakened to such an extent that when it is given to a person, it does not make the person sick. Some of the vaccines will only have a part of the disease germ.
Vaccines work?
When a vaccine is given to a person, it stimulates the immune system of a person, which will produce antibodies, and these antibodies will give immunity to the person against that particular germ.
Okay doctor, so as you said antibodies and immunity, so can you elaborate on these two topics?
Yeah. See, when a vaccine is introduced to a person, it's something which is foreign to the person, and that's why it will stimulate there's something like an immune system of the body which recognizes what is self and what is not self, that is the foreign. So now it will start producing certain protein substances against this foreign invasion, and these are called as antibodies. Some of the diseases or some of the vaccines, these antibodies will remain in the body lifelong, whereas for some the antibodies may go down, but when the disease is introduced again, as the body already has a memory, it will start producing the antibodies immediately, and it will deploy all these antibodies towards the germ cell, which will get inactivated, and it will not give a chance for that germ cell to cause an infection in a person, and this is called as immunity.
Okay doctor. And doctor, is influenza vaccine effective?
Yes, it is definitely very, very effective, and all the persons who are likely to get influenza, like pregnant women or those who are immunocompromised or those who are above 65 years of age, who are likely to not only have an influenza but a serious consequences of influenza, should definitely be immunized.
influenza affect a pregnant lady?
As we all know, during pregnancy there are a lot of changes in the body. Certain changes are anatomical changes, certain changes are physiological changes. Pregnancy does decrease the immune response of a female. There are many changes in the cardiovascular and the respiratory system. And because of this, a pregnant woman is more likely to have complications from influenza. It's not that the pregnant woman is more likely to catch influenza, but if she catches, the rate of complications will be more. For example, the incidence of hospitalization is twice more if a pregnant woman catches influenza as compared to her counterpart who is not pregnant. And if this pregnant woman happens to have a comorbidities like obesity or a diabetes or a hypertension, the risk of hospitalization may even go to 10%. Not only the hospitalization, if it really causes a serious disease, they are more likely to have a ICU admission. This is about the pregnant woman. But a pregnant woman who has influenza, and if she is not vaccinated, even her unborn child is at risk. The incidence of low birth weight of a newborn or preterm delivery, or for that matter, rarely even a fetal death, is slightly higher in women who will get influenza and if they are not vaccinated.
Okay, doctor. And doctor, is influenza vaccine safe during pregnancy?
Yes, it's absolutely safe during pregnancy, and not only safe, it has various benefits. That's why we recommend influenza vaccine to all pregnant women.
Yes, doctor. And doctor, how is the safety of flu vaccines in pregnant people monitored?
See, there are certain statutory bodies like a CDC, which is a Center of Drug Control, or a FDA. They monitor the safety of vaccines, and this is monitored by reporting the adverse event of a vaccine. So they will analyze if there are any adverse effect, and then thus the safety is monitored.
Pregnant women get a flu shot?
Pregnant women should take a flu shot not only to protect herself, but it will also protect her unborn child from the influenza.
And doctor, how does the vaccine protect during the pregnancy of the woman?
As we have said at the beginning of the talk, if this influenza vaccine is given to a pregnant woman, it will cause antibodies against the influenza germ. Now, later on during the course of her pregnancy, if she gets exposed to the influenza, the antibodies are already present in her body, and that's why these antibodies will go and attack the germ which is causing influenza, and it will kill it. It will not give a time for that influenza germ to cause a disease in a pregnant woman. Sometimes even if the disease occurs, it's much of a milder variety as compared to those who will not be immunized.
Okay, doctor. And doctor, can flu vaccination result in miscarriage?
No, there are many myths about the vaccine, and one of them is this: it will definitely not result in a miscarriage.
So it's time for a short break now. We will all see you in next few minutes. Welcome back to Narikaa Talk Show again. Moving on to our next question, which is, and doctor, how often a woman should receive an influenza vaccine shot?
Influenza vaccine should be given to her only once during the pregnancy. If at all, if she has received the influenza vaccine just before getting pregnant, maybe just about 2 or 3 months prior to it, then she may not even require an influenza vaccine during pregnancy, because the protection will be almost at least for a year or so.
And doctor, when is the best time to have the vaccine during pregnancy?
There are many studies conducted on the safety of this influenza vaccine in pregnancy. Most of the studies are conducted in the second and the third trimester. There are few studies which are conducted even in the first trimester. Most of the bodies like a WHO or a ACOG, they advocate that it can be given in any trimester, especially if there is a pandemic or a woman is more likely to have a influenza. By and large, as far as possible, we usually give it after the first trimester is over, because first trimester is the time where baby's all organs are formed. And that's why unless and until it's absolutely necessary, we avoid all the medicines, all vaccination during the first trimester, but it can be given even in any trimester.
Yes, doctor. And doctor, can antiviral drugs help a woman to recover from flu during pregnancy?
First of all, vaccine will not cause a flu. So there is no question of giving antiretroviral drugs. What vaccine can cause is maybe a mild fever, which can be managed only with some antipyretic simple drugs like a paracetamol.
Work as same as the influenza vaccine?
No, there's a lot of difference. Antiviral drugs will control the disease once it has already occurred, whereas vaccines, by giving immunity towards that particular germ, will prevent the influenza. So there's a difference between the way they act.
Okay, doctor. And doctor, which one is better, influenza vaccine shot or antiviral drugs?
Obviously, as the saying goes, prevention is better than cure. So the vaccine will be preventing the disease, whereas antiretrovirals will cure the disease once it has occurred.
Okay, doctor. And doctor, what side effects have pregnant people experienced from flu shots?
The side effects are same as in a general population. When you take any vaccine, it's not particularly because she is pregnant, she is going to get more side effects. First of all, the side effects are very, very mild. It's something like a little soreness or a redness and a swelling at the injection site. Rarely it may cause headache, fatigue and a mild fever, which can be managed with simple analgesics and antipyretics.
Benefits for the unborn baby during vaccination?
When a pregnant woman is given vaccine, her body starts producing antibodies against that particular germ cell. Now these antibodies are passively passed through the placenta to the baby. After the delivery, a newborn cannot be given influenza vaccine immediately, and during this time, the antibodies which were passively passed from the mother to the baby will protect this newborn from influenza.
Okay, doctor. And doctor, when should a baby get his or her first influenza shot?
A newborn cannot be given influenza vaccine for first 6 months of life. After 6 months it can be given. So during these 6 months, it is the maternal antibodies which baby has acquired will protect the baby from influenza.
Yes, doctor. And doctor, where should a person get vaccinated?
A person can get vaccinated at any establishment, because nowadays many a times people do receive even influenza vaccine in their college or offices. It can be given in a dispensary. Only if a person has a history of a severe allergy, then that person should receive an influenza vaccine in a medical setup, where if the severe allergic reaction occurs, that setup is equipped to tackle with this allergic reaction. vaccine, that is the ethyl mercury, is added in a multi-vial drug. That means the vial which has multiple doses. It's usually given when it is given in a camp basis. It can come as a multi-vial drugs as well as in a single vial. When it is a multi-vial, because you are taking the vaccine every time, there are chances of contamination, and this thimerosal will prevent bacterial or a fungal contamination. But most of the times when we are giving to the pregnant woman, it's a single dose, and that's why it does not contain thimerosal.
Yes, doctor. And doctor, can a breastfeeding person get a flu vaccine?
Yes, definitely. If she hasn't received it during her pregnancy, postpartum period is the best time to counsel her and give her the influenza vaccine.
Okay, doctor. And doctor, can a person have the COVID vaccine and influenza vaccine at the same time?
Yes, they can have at the same time, only it should be at the different anatomical sites. Sometimes people are little skeptical because what if the fever occurs, then maybe at the most they can have a 1 or 2 days gap in between.
And doctor, are there any people who should not get any vaccines?
Particularly a influenza vaccine, if a patient had had a Guillain-Barré syndrome within 6 weeks of the last immunization, or if there's a strong history that this particular person, when she took an influenza vaccine last time, had a severe allergic reaction, then in that case it should not be given.
Okay, thank you doctor for sharing your informative views on it. And I hope this session was really helpful and beneficial to all the viewers out there. So doctor, before leaving, is there anything else that you would like to share with our viewers?
I think, as I already said, if there are medical facilities available like vaccine, every person, it's not only the influenza and a pregnancy, if there are safe measures which can prevent the disease, that is the vaccines, everyone should take it as and when required, rather than getting disease, falling sick and having complications of it. Thank you.
Well doctor, that was really a great response, and it really means a lot to us to be with you in a Narikaa talk show. And thanks a lot for your precious time.
Thank you very much, Riya, and I thank Narikaa for giving me this opportunity. Thank you.
Thank you doctor. So we will all see you in next session with another interesting topic. Till then, to all the lovely viewers, stay tuned, stay happy, stay healthy.